Hello, my name is Dr. Eldred Taylor. My wife, Dr. Eldred Taylor, and I wrote the book, Are Your Hormones Making You Sick? The reason why we wrote the book was to educate women about hormones so cases like this would not happen. We want to educate women so that they can take control of their health. This is a case about hormones, menopause, and breast cancer. Now, this should not happen. This is a 66-year-old white female. She complained of hot flashes, mood swings, fatigue, poor concentration, weight gain, and memory problems. Now, she was on 3 0.1 milligram estrogen skin patches for years and stopped 2 months before I saw her for the first time. Now, this is 12 times the dose I usually prescribe if I prescribe estrogen at all. Her doctor was monitoring her estrogen levels with blood testing. Her blood test showed that her estradiol was in the normal range. You can see here on the saliva test, her estradiol is above 3,300. It's higher than the test can even measure. Now also, if you look here, that you see the estradiol is far above the normal range. The normal range is 3.7 to 9.4, where her total is, again, greater than 3,000 on average. Also, you see here that her progesterone-estrogen ratio is low. You need to have enough progesterone to balance out the amount of estrogen that a patient may be making on their own or that you may be giving through patches or any other means. Why is it different? Well, the saliva reflects how much hormone is in the tissue. The blood delivers the hormone to the tissue, and it can accumulate there. Now, just think if FedEx was sending you 30 packages of estrogen a day, and you only really needed 3. If I look at how many trucks are coming to your house every day, that would not change. But if I came to your house and you let me in, I would see that your house is overflowing with estrogen. Saliva lets me look into your house. The blood tells me how many trucks are arriving. Blood does not tell me how many packages are being delivered or how many packages are accumulating in the tissue. Now, this is an unnecessary outcome. 5 months after this initial visit, she had a mammogram that was negative. Because I told her her estrogen level was extraordinarily elevated, she pushed to have an MRI. The MRI showed an estrogen-sensitive cancer. She had to have a double mastectomy and reconstruction. Now, when your tissue is overflowing with estrogen, estrogen will cause an overflow of growth of tissue, normal tissue and abnormal tissue. If her estrogen levels had been monitored correctly, it is unlikely she would have had this outcome. Please take advantage of the resources on the website to further educate yourself about bioidentical hormone replacement. When used appropriately, it can enhance your life. When used inappropriately, hormones can cause unnecessary outcomes. Remember, blood lies.